The human heart is a dense, continuously working metropolis. To keep its millions of cells alive and functioning, this city requires a constant, uninterrupted supply of oxygen. To deliver oxygen, the heart relies on a dedicated highway system of coronary arteries branching around the muscle. Specific branches feed specific neighborhoods. The left anterior descending artery, or LAD, is the primary supply line for the anterior wall. Consider what happens when a sudden blockage prevents these supply trucks from reaching their destination. Heart failure frequently stems from a breakdown in this internal plumbing. When these supply lines fail, the muscle tissue starves, lacking the oxygen it needs to stay alive. This is a cross-section of a coronary artery undergoing atherosclerosis. Over years or decades, cholesterol and fat accumulate along the inner wall, gradually narrowing the channel and restricting the roadway. The danger peaks when this brittle plaque ruptures. The body responds by sending platelets to the site, clumping to form a solid blood clot. This completely halts blood flow. Downstream heart tissue enters ischemia, severe oxygen starvation, cut off from its vital supply. Certain habits accelerate this buildup. Smoking damages the smooth inner lining of blood vessels, making it easier for fatty debris to stick and accumulate. A heart attack is the precise moment the road transitions from narrowed to completely closed. This blockage starts a rapid, biological countdown towards cell death. When heart muscle starves, it sends out immediate distress signals. The most common alarm is a sensation of crushing, heavy pressure or intense tightness located in the center of the chest. These signals often travel along shared nerve pathways. A patient might feel this ache radiate into their left arm or move upward into the neck, jaw, and back. Symptoms can also be subtle, particularly in women, diabetics, and the elderly. Instead of crushing pressure, these patients might experience extreme fatigue, dizziness, or mild physical discomfort. Regardless of how the symptoms feel, the timeline for the muscle is the same. Irreversible cellular death, or necrosis, begins within 20 to 40 minutes of the initial blockage. These alarms require an immediate emergency response. Waiting for the discomfort to pass allows the damage to become permanent. Paramedics use the MONA protocol to reduce the heart's workload. This includes administering pure oxygen from a tank like this one, maximizing fuel reaching the struggling muscle. Aspirin is another critical component of the early response. It acts as an antiplatelet agent, preventing the blood clot from growing larger during hospital transport. In the hospital, doctors use coronary angiography to visualize the blockage. By injecting a specialized dye, they can see the exact point where the vascular tree is obstructed on this monitor. To clear the lane, doctors often use percutaneous coronary intervention, or PCI. They inflate a tiny balloon to compress the plaque and leave a wire mesh stent behind to keep the artery propped open. For complex or multiple blockages, surgeons may perform a bypass. They take a healthy vessel from another part of the body and sew it into place, creating a new detour around the traffic jam. The medical objective is to restore blood flow through any means available, like chemical thinning or mechanical propping or surgical detouring, before the heart tissue breaks down. Once the acute crisis passes, the focus shifts to long-term road maintenance. The heart's infrastructure remains vulnerable and requires consistent care to prevent a second blockage. Daily medications play a vital role in this maintenance. Statins, for example, work like a permanent street cleaning crew, lowering the level of cholesterol in the blood to stop new debris from accumulating. Primary prevention rests with the patient. Adopting a healthy diet, managing stress, and regular exercise strengthens arterial walls and keeps pathways clear. A heart attack is a manageable plumbing issue. By understanding how these supply lines function, you can take control of your cardiovascular health and keep your own highways open for a lifetime.